truly is an organic flow of this work around quality improvement around HPV vaccination. So, you're all pulling, your data, right? You've all pulled those baseline data. You have the ability to look at these reports. And then from that, you get those patient lists, right, to start those outreach. And that outreach can be, like I have here, it can be text messages, it can be the patient portal, it can be calls and educational letters. I would say if you're going to send a letter to a parent, it's an opportunity to educate, right? So we want to make that as robust. And you all got those educational letters, quite a few months ago. Then that rolls into, okay, you've reached out to them, you brought them into the practice. Now, you've got this pre-visit planning, so you're going to look and see who's coming in, and we're going to put in prompts to remind those providers what they're due for. Then once they're in there, we want to look at, okay, what did they come in for a visit, right? Was it a sick visit? Was it a sports physical? Was it a well-child visit? And they got DTaP meningococcal, but for some reason they didn't get HPV. And why is that? So that's what we're going to talk a little bit about today. This is where this work flows. And so all of you, are doing this already. And so then again, this rolls back into, right, our HPV vaccination baseline data and our monthly reports. And again, that AFIX product, you're going to be able to do provider level data. You'll be able to look at DTaP and meningococcal, right? So if we're focusing on HPV, and we know these are adolescent vaccines, usually we'll see an uptick in meningococcal and DTaP as well. And then again, we pull monthly data, as you all know, for our 11 to 13-year-olds in the practices. So again, just think of this as really this organic piece, and in the middle is really all about engaging and educating staff along the way, and not just once, as we know, right? As adult learners, we need to hear things multiple times. Next slide, please. So what is a missed opportunity? For us, we're focusing on 11 to 13-year-olds. And a missed opportunity, which you all know, I'm sure, but just a reminder, is when an eligible adolescent leaves their healthcare provider without getting an HPV vaccine for our purposes, right? Even when they've received other vaccinations, such as their DTaP meningococcal and possibly their flu vaccine as well. So the President's Council Panel Report, I put a link in here to this. It's a great resource. And just to show that we're on target with this didactic and the flow of this work, this came out, so the first report came out in 2012, 2013, and really this call to action, right, around HPV vaccination. We have a vaccine that prevents cancer. So we have this opportunity to really pull this together. And so their number one goal within this President's Council Report, so they did another, looked at this again in November of 2018, so pretty recently, is really their number one goal was to reduce missed clinical opportunities to recommend and administer the HPV vaccine. So very important and very pertinent in this work. Next slide, please. So the first step, again, is looking at the strong recommendation. We've already talked about this. We've got a didactic on this. But again, that rolls into these missed opportunities, right? Because if we're not talking about this with our parents and our families, then we're missing that opportunity, right? To have that strong bundle. Remember, we've talked about this, same way, same day, and HPV in the middle, right? Meningococcal, HPV, and DTaP. So really important. So again, think of that. All these pieces will hopefully fit together as we continue talking about this. Next slide, please. So the strong recommendation that we talked about, again, every visit, we want to think about that and how it's recommended. And again, like I just mentioned, that strong bundled recommendation, same way, same day. So again, just remind yourself again. And the number one reason, right, that we know that parents will vaccinate is a recommendation from all of us. So number one, multiple research on that. So again, right, this falls into missed opportunities. We should not be not talking about vaccines, right, no matter what visit type. So every visit type is an opportunity to not only vaccinate. And if you take nothing away from the didactic today, this would be it, truly. So, I know when I started this work, I think, okay, we know that they can also get HPV vaccination if they have a sick visit, right? Depending on that sick visit, depending on that provider's assessment, but there are some guidelines on that the CDC gives us, and so we can sometimes vaccinate when they're coming in for a sick visit. So, you think of that, okay, however, it's also two other opportunities. It's an opportunity to educate, right? You're pulling hopefully that immunization, the impact immunization report when they come in, so you know what they're due for. So even if they don't get it, right, that is an opportunity, because as we know, some patients only come in for sick visits. We wish they came in for all their well visits, but that's not always the case. So looking at how we educate that, so handing them a vaccine, you guys have all had multiple handouts of things that we've shared. Again, to educate them what their child is due for, talk to them about the HPV vaccine, answer any concerns they might have. And then that next step is to make that appointment, because now, right, in your pre-visit planning, you've identified that they're due for a well-child check or a vaccine-only appointment. And you can say, you know what, since you're here, on the way out, why don't you just stop at the desk? Here's a little reminder, just give this to the PSR at the front desk and they will help you make that well-child or vaccine-only appointment. So again, I just encourage you to think outside the box on this, pulling the impact report for every visit type, regardless of what that visit is, and using that opportunity, even if they don't get the vaccine, again, to educate and then make that appointment. So again, that's what I have really taken away in this work. And then tracking this is really important. So we want to track this because we want to see how we're doing, right? So you guys are doing all this great work, right? You're doing the outreach, you're pulling the reports, you're doing the outreach, you're getting them into the practice, and you're hopefully, right, majority of the time administering the HPV vaccine. But we all know for various reasons that might not happen. Whether the parents decline, it's a sick visit, the provider doesn't want to give the vaccine, then whatever that is. But what's really impactful and in this work, and again, an evidence-based intervention, is giving back data to your providers and clinical staff on their own patients, right? So we can talk about this at length, and we can talk about missed opportunities, we can talk about research, but again, to share and say, okay, you know what, Dr. Smith, we've been, and again, you want to do this across all teams, or maybe you take one team and try this, right, and track it, see how that works, and you say, okay, you know what, I had 20 kids in that all would do for HPV, 10 had physicals. Of those, 5 of them got the HPV vaccine, 5 did not. The parent declined. So then there's always that next step that really rolls into this is documentation. So they didn't get it. So was a conversation about HPV and an educational component done and documented? And was a declination form for those of you that use those signed and scanned into the EHR? And then providing that back to providers and clinical staff, right? Because they may think, and I can certainly speak for myself as a provider, right? Sometimes we think we're knocking it out of the park, and you think that those rates are higher than they are, and then you get those, and you're like, "Ooh, that is not where I kind of thought I was on that." So it's again really impactful to share this back to providers and clinical staff. Next slide, please. So the 5th one is, again, and we've talked about this, and I presented on this a couple didactics ago, and I'm really, I have to see in all this work that you're doing, and I think focusing, and I think the case presentation we have today falls into this really well is also, just coincidentally, is again creating that pro-immunization culture, right? You're teaching your staff, you're giving them talking sheets, you're making sure that they feel comfortable and knowledgeable about the HPV vaccine and are able to talk to parents, and that they're taking that time, right? You've heard us say this before as well, to find out what that one reason is. What is that biggest reason that they're not getting their child vaccinated today? And then addressing that with either research, handouts, whatever that looks like. Next slide, please. So I just wanted to show you this. Again, you've seen things like this. I presented in the very beginning. Anna, thank you so much. She actually sent the link to me when I shared this. As faculty, we share the didactic back and forth and ask for input from each other. And always great to have, great minds kind of put their, right, I'd say with Anna and Teresa, those great minds to put their, their thoughts around this. And so she shared the link that links up to 2018. So I'll be sending that out along with the slide deck at the end. So just so you know that. But again, the big takeaway from this is really that when you look at this, right, DTaP and meningococcal are on the top. Not surprising to all of us, right? Not surprising, 80th percentile usually for both of those vaccines. And then, again, so this also tells us these adolescents, age 13 to 17, are coming in, right? Because if 80% of those that are coming in are getting vaccinated, then we know that our HPV vaccine should be up there as well. So that's that gap. That right there is the entire didactic today. That's missed opportunity, right? That is that opportunity that they came in, they got their DTaP, they got the meningococcal vaccine, but for whatever reason, they did not get HPV. And truly, that is our role to figure out why. So next step, please. This shows this again in just a different way. Again, this is from the key cancer prevention slide deck that I've used a lot in presenting. And again, this is 91.3%. And this is saying this isn't even like completing HPV, right? This is that they got one dose. So they're saying that of the opportunities when they came in, right, if they got one dose, their first dose of HPV vaccine, when they were seen in the office, they would have hit 91.3% of those 13-year-old girls born in 2000. And instead, it's actually 47%. So that gap, again, those are missed opportunities. You know, what is it what's that difference, right? We have a vaccine that prevents cancer. So what is it that is that disconnect, right? And that's what we're all going to look at and work on together in tracking these missed opportunities and then looking at that and talking to your staff. So again, this is HPV-1, actual and achievable, and again, that gap is the missed opportunity piece. So keep recommending, you know, don't give up. So if a parent declines, right, they may accept it a later visit, you know, and this actually, again, rolls beautifully into the case presentation, totally not planned, but thank you, Angela. That was, you know, really perfect, you know, a segue. But again, they may decline, and I think a lot of it is, and we're going to talk about this, and I don't want to give away the case presentation, so I'm going to actually stop right there. But again, it's our job to educate them as early as possible. And so every opportunity, right, is an opportunity to promote HPV vaccination at any visit type. And again, declination is not final. So a parent deferring, and this is another thing I've taken away in this work, there's a big difference, right, between deferring it and a final declination. So they may defer it for multiple reasons, right? They want to wait, they want to, and we've all talked about this, right? The importance of those antibodies. It's better to vaccinate them earlier so that that big antibody response can be, you know, those warriors I say, you've heard me say before, can go into action to protect them when they are exposed. So always go back and revisit that. And so I found this slide, and I was trying to actually find the article, and I will still look for it, and I couldn't find it before today because I just happened to find this morning. But basically, I want to just give you a couple quick stats, and that is 45%. So among parents who initially declined HPV vaccination, so 45 of those parents who initially declined, 45% reported accepting the vaccine at a later date. 45%. That's huge, right? So again, that declination, that first deferment, that may not be final. They want to learn about it. You taking that time to teach them, give them handouts, really can be incredibly impactful in this work. And then 24% intended to accept the HPV vaccination in the next year. So again, they may be deferring it now, but 24% of those parents who initially declined are going to accept that for their child. And if you look at that and say, oh, they declined, you know what, they don't want it. Again, that may not be the case. So I think this research shows that. So again, just always coming back around to that. Next slide, please. So education is the key to success. You know, I think this is something that we all talk about, and we all feel very empowered in this project to really educate our families and communities that HPV is truly cancer prevention. You know, as you all know, and they've heard me say many times in our faculty, you know, HPV is cancer prevention. And, you know, again, we have the cervical dysplasias and things like that too, genital warts, multiple benefits of HPV. But again, we can prevent cancer, and we need to educate because there's still that lack of knowledge. You know, we're still seeing that out there. So I just, I think I want to wrap up there. I'm just going to have you go to the next slide. I think that's the last one. So I just want to stop for a minute and thank you all. So again, I appreciate this opportunity.